Namaste to all of you. Dear friends, today's topic is very interesting topic, that is high blood pressure. We in practice every day we get so many patients with high blood pressure, and interesting thing to know is that they are not even aware of. That's why this is called silent killer. Silent killer, that it starts with almost no complaints. You see, a high blood pressure is benign condition. Typically, there is no symptom. One can feel fine, but inside there is trouble brewing. He is not aware of, but he is going to have very dangerous disease. That's why this is called silent killer. So, patient come to us, by chance we come to know that, oh, this is beginning of blood pressure. One should go to his doctor, to his GP regularly to get his blood pressure checked. Because if you know, you can do something. You see, blood pressure is amount of the force caused by the blood pressing against the wall of the arteries. Heart is a pump that delivers blood to whole body through blood vessels of all the sizes. But arteries that can get less elastic because of a few conditions like obesity, people those who have smoked, that is one of the reasons, then physical inactivity, old age, diabetes, or people they are having alcohol every day or using more salt. These are the conditions when our arteries can get less elastic. And if our heart has to pump through this narrow and stiff arteries, that make rise in the blood pressure. So that is the cause of the high blood pressure, because your arteries are narrow and stiff. So narrow and stiff arteries, that makes rise in the blood pressure. So why high blood pressure is that bad? We have to understand. Because high blood pressure damages the wall of your arteries, and that makes it easier for every fatty substances to deposit, to build up over there, and that can disturb the circulation of the blood. And if circulation of the blood is hampered, then oxygen supply to that area is hampered, and it can give very complicated diseases like kidney failure. It can give you coronary heart disease. So it can give you stroke. It can give you memory loss. So, to understand blood pressure, we know that left part of our heart, left ventricle, that constrict and blood goes through the aorta to whole body. And heart beats 70 times a minute. So it means that 70 times it's creating a pressure on the wall of the artery. So this has got two types of readings. One is systolic and one is diastolic. Systolic is when heart constrict. So it gives a certain pressure on the wall that we call systolic blood pressure, and that should be 120, 130 in between. And then when heart relaxes in between two beats, that's the pressure what we call diastolic. So 40-50 years ago, it's considered diastolic more dangerous than the systolic. But now medical science, they have come to know that systolic pressure is much more important. Because if systolic pressure, when heart constrict, if that pressure is more, that is going to damage the wall of your artery. So that damage, that can lead to lot more problems, because that damages where cholesterol and all that unnecessary stuff, what is as a toxin running in the blood, that is going to get deposited over there, and that is the cause of the obstruction of the blood supply, and that can get serious problems. And that's why they say that systolic pressure should not be more than 120, 125, 130 maximum. And diastolic pressure, when heart is at rest in between two beats, so it can be 80, it can be 70, doesn't matter if it's little low. So one should be maintaining his blood pressure around 120, 125. But if systolic blood pressure is a little low, let's say it's 100, it's going to give you less circulation in the brain. People will feel weak, dizzy, and they can get memory loss and loss of concentration, low energy, dizziness, sleepiness, this type of things one can get. So if systolic pressure is low, then we should raise that to 120 because it's going to give good blood supply to your brain. That's what is real important. So there are a few factors what can cause high blood pressure. So number one is amount of the blood in the body. If amount of blood is more, then of course blood pressure is more. So then second factor is that amount of the blood what your left ventricle has to constrict. If that volume is more, of course that is also going to give you high blood pressure. And then third one is resistance. Resistance is anything working against the flow of the blood in the artery. So we can say that resistance is mainly because of the width of the artery. If width is less, blood pressure is high, and if width is more, blood pressure is down. So simple is the resistance. Then fourth factor is the viscosity, thickness of the blood. If blood is thick, of course, then heart has to work more and blood pressure is more. So blood should be thin, it should not be much in volume, there should not be any resistance. So these are all factors what gives you high blood pressure. So in Ayurveda we have got Vata, Pitta, Kapha type of blood pressures. You see, Vata person, they are prone to get Vata type of blood pressures. Since Vata is associated, Vata's place given in the body is our large intestine, colon, and Vata persons, they are cold, they are dry, they are prone to have constipation, and that way toxins can't be removed, and that creates autotoxicity. And that autotoxicity, with the time, that is going to circulate through the body. And circulating through the body, that's going to constrict the artery, causing high blood pressure. Psychologically, Vata type of persons having this type of blood pressure, that is then associated with your fear, anxiety, stress, sleeplessness, hyperactivity of the mind. So what one should do to treat high blood pressure is that we should be giving them, first of all, detoxifying of the colon. We call that enema therapies. And after detoxification, we should concentrate on Vata pacifying diet. We should be giving some sedatives, nervine tonic to reduce fear, anxiety, and doing much more yoga, taking time for themselves. And these are the measures what will help someone to reduce Vata type of blood pressure. Then we have got Pitta type of blood pressure. And that is also known that Pitta personalities, Pitta Prakriti people, they are prone to get this. Herein, toxins from undigested food, what we call ama, that is going to circulate with the blood and that is going to cause more viscosity. And heart has to pump then extra. Physiologically, if we see, this is associated with people having more jealousy, anger, hate, high temper, criticism. So that is what we see is associated with high blood pressure. So then what we have to do, we should give them anti-pitta regimens. We should work on metabolism. We should correct pitta. We should see that digestion is better so that no toxins like ama is being produced and viscosity of the blood is not hampered that way and heart doesn't have to pump extra. So this is the management what we have to do, that is anti-pitta, pitta management. So then we have got kapha type of personalities, kapha prakritis, and they are prone to have kapha type of cholesterol. And so as we know that kapha is given place in upper part of our stomach and bronchi. And it has to do in the upper part of the body to secrete few enzymes to digest the food. So that is all of the sweet nature, kapha, and these enzymes that contributes in producing cholesterol, triglycerides type of substances, and that's going to cause narrowing of the arteries, and that is then obvious reason for having high blood pressure. Then what we should be doing in this case, we should be managing kapha. So if kapha is stimulated, if kapha is more and giving more that type of secretion, enzymes to make cholesterol, that we have to lower. And we should be giving anti-kapha diet. And we should be giving lifestyle according to kapha. So the person should do exercise, he should go to gym, he should reduce his weight. If kapha is reduced, then triglycerides and cholesterol is reduced. Then the viscosity is also reduced, and that way narrowing of the arteries are reduced and people will get better. So as I said that this is a silent killer, people in the beginning, they don't have much established symptoms. Only by chance we come to know about patient having high blood pressure, but still in the beginning one can have headache early in the morning with dizziness, and gradually, slowly, symptoms increases like nasal bleeding. So that nasal bleeding, because with the high blood pressure, the small blood vessels, small arteries that can get bleeding with the pressure. And breathlessness is also one of the early symptoms of high blood pressure. So if not treated, it will develop into confusion, nervousness, palpitation, sweating, and weakness, loss of memory, loss of sleep. So patient, they will develop this type of symptoms. Then what one can do himself? Of course, lifestyle, and we should give attention to the food. The food what one can choose is walnut and beetroot, flaxseed oil, potassium-rich food, banana, because potassium relaxes the arteries. And you should avoid salt, you should avoid alcohol. You must give attention to your lifestyle, that it should not be creating stress. It should not be giving you that hyperactivity. Generally, this food and lifestyle tips that helps in begin stadium. And once the blood pressure is established, then you must go to your GP. You should let it treat it with medicines. Your heart should not be working extra. Pumping should not be that hard that it damages your blood vessels. So something for blood vessels should be given. So in Ayurveda, we have got beautiful herbs like Arjuna, we have got Hirda Bala, we have got Prabhudex. We have to see the patient first. Then we see if it's Vata type, Pitta type, or Kapha type. Then we can plan and what to do. As I explained, Vata needs different type of treatment than Kapha. So few things what everybody can do. So we have got Ceribex capsule that is very, very good for Vata type of persons along with Arjuna tablets. This combination is good for Vata, and for Kapha type of persons, we should be giving Ceribex with Trifla Google. So, Pitta person, we have to correct his enzymes. We should be working on his digestion. So that way we can correct his enzymes, digestion system, and can control high blood pressure. So in short, this is a silent killer. You have to take care of yourself by going to doctor regularly. After age of 40 years, you must measure it and take precaution. So I think I could make my message clear, and next time I'll be coming with new chapter. Thank you very much.